Hi guys, this is the Ace Perspective, giving you part 2 of the primary schools closed, why are nurseries still open saga. Now, I did a video a few days ago having a rant at dear old Boris. I think today I shall give Boris a break and I shall have a rant at Michael Grove and Williamson. Now, I said in my last video that there was no scientific reason for why nurseries were left open and primary school were closed, as effectively one in another, same thing. The DFE, Department of Family and Education, has now given some reasons as to why nurseries and childminders were left open and was told to carry on business as normal. I'm going to summarize it because, to be honest, a lot of it was just a bit of win service. I could have answered this yesterday, but I waited because Boris called a briefing out of the blue, and I thought, Boris might have woken up, decided to follow Nicola again and close the nurseries. Unfortunately, this didn't happen. Boris turned up with Christopher Whitty, Professor Whitty, shall I say, a dead ringer for Jacob Marley from Ghost of Christmas Past. And they then proceeded to blind us with science. In that, tell us how great they were doing and how many vaccines they were administering and intended to administer in the near future, making us top of the league table just behind Israel. This is something that the government always does when they've cocked up. They then come back with the men in white coats and decide to blind us with some science and some graphs. Well, that didn't detract from the point that he didn't reverse his decision and he kept the nurseries open. In the main, the Department of Family and Education decided that nurseries should be kept open because they were deemed a low-risk environment for children, had the lowest confirmed rates of coronavirus of all the age groups. What else did they say? They said that evidence shows that preschool children are less susceptible to infection. They then referred to sage advice, and they say also that earlier settings were opened early because of this. They also made a point, I'm really summarizing it now because I don't want to bore you with long discussions of what Gavin Williamson or Vicky from the education department said. But effectively that was it. And then they went on to say how great early years was, how vital it was to young people to get the best start in life, and that early years is doing a great job. That's effectively what they said. Right, now the counter argument to that, I'll take it one by one. Early years remain a low-risk environment for children. Continue to have the lowest confirmed rates of coronavirus. That doesn't make any sense whatsoever. Confirmed rates of coronavirus. Now, I don't know if you know this, but have you tried getting a coronavirus test for an under 5? Before July, there was only one circumstance where you could get a test for an under 5, and that was when there was a pressing clinical need to do so. After July, you can get a test, but you were discouraged from getting a test, and only if you had symptoms. Now, bearing in mind, it's widely acknowledged that children tend to get coronavirus more mildly than us oldies, or they're asymptomatic. Why would you need to go and get a test? So you're going to have less confirmed cases because they're not testing them. I know from our personal experience, when the teacher came down with coronavirus, some parents went out and got a test, even though their children didn't have symptoms. And guess what? They had coronavirus. Now, if our staff member didn't come down with a virus or didn't get tested, or just self-isolated, the child would not have got tested and we would never known. Now, we've had 4 members of staff come down with coronavirus at one point. We're quite strict in the amount of contact we have with parents. They hand over in the playground. So where did we get the COVID from? It's no coincidence that once it was in the nursery, it spread like wildfire. One of the examples, or one of the principles behind the government's decision, is that children are less susceptible, which we agree, to the severity of coronavirus, but they're not super spreaders. Well, again, how would you know? They wouldn't have a clue because they're not getting tested. And when we're coming down, the teachers are coming down with COVID, we're often self-isolating because there's no confirmed cases of COVID because the child is never tested. We have children coming in and out the nursery every day with runny noses, mild symptoms, and we say, don't bring the child in. The child may already had coronavirus. Some parents bring the child in, and we all heard of the parent who, we call them the cowpool parent. Child is not well, needs to go to work, dose them up with cowpool, send them in. 4 hours later, cowpool wears off. All these blows away any argument about the lowest confirmed cases, because unless you're testing children 0 to 5, how will you get a confirmed case? Funny enough, even yesterday, I received an email from a local authority, and the local authority was very, very, how can I say, congratulatory on themselves by saying, Happy New Year. By the way, everyone in the borough aged 12 and over can now get a free and regular coronavirus test, even if you haven't got symptoms. That was after the comma. These include the new rapid tests, which provide a result within 40 minutes. That in itself tells you everything. Everyone in the borough aged 12 and over. Where does it say between 0 and 5? Now, if I took 10 12-year-olds to get tested and 3 was confirmed, and I took no 0 to 5-year-olds, what do you think the statistic will say? They will turn around and say the 12-year-old had more confirmed cases than the 0 to 5. That was just a waste of a statistic because the evidence behind it, there wasn't any. Now, that brings me to, can a youngster, can a child, can a baby, 0 to 5, transfer or transmit coronavirus? Now, it was long argued that no, they don't, or they do, but they're not super spreaders. Now, I've did a bit of research, Harvard Medical, Independent. They all acknowledge that at the beginning they thought the same thing. Now they don't. There's an article the 27th of November from Harvard that says no, the child or children, young children, carry more viral load. And even when they don't have any symptoms, they can spread COVID. So they're quite concerned. The Independent did a research of a school in, I think it was, Control for Disease and Control Prevention. And they had an outbreak of COVID. This is Utah. And then they found out that the children spread the COVID to staff members, and they went home and spread it to their parents and their siblings. So that argument don't really work out either. So they can spread it, or there's no confirmed, or there's no 100% definition, and the government can't provide that children can't transmit COVID, or the under 5s. So they can't confirm this, but they're of the opinion. And this is funny because they say, well, you know what, Sage, we get our information from Sage. Now, Michael Grove himself was interviewed on BBC about early years. And he made a point of saying, well, early years are there to support key workers and it's vital and all the rest of it. But the problem is that the BBC Breakfast also included an interview with Professor Callum Semple, a virologist and SAGE member. And they asked him, could he explain why early years setting remained open? He said, no, I can't. And the decision to do so may be political. Now, he's a SAGE member. Now, he doesn't understand or he cannot explain why nurseries are open but primary schools are shut. Pretty embarrassing. But there you go. Lastly, I thought was quite funny is that the Department of Family Education made a big point of saying early years is crucial to young people. The first 5 years of a youngster's life or child's life is important for their mental health and their well-being and etc. and etc. etc. Now, that begs a question. And I thought, oh, that's interesting. I didn't realise that the Department of Family and Education and the government felt so highly about early years. And my question is, if they feel that strongly that they can keep nurseries open when primary schools are closed, businesses are closed, because we are the cog in the wheel of starting a youngster's life, why then is the National Education Grant, we call it the NEG, hourly rates so low? Early years settings have argued for years that the rate's too low and it's very difficult to sustain a business on such a low hourly rate. And that's the free entitlement, they call it. It's been low for years. The government has ignored it, and there's talk about reducing the hourly rate. As it stands now, I think the ballpark figure is £4.50 an hour for NEG 3 and 4 year olds, and then they add on a supplement if you live in if your settings in a deprived area like Beirut or something. But this is what they say. So you can't have your cake and eat it. You can't, on the one hand, say early years is so vital that we have to close everything else and keep early years open. But then when it comes to funding, you refuse all funding because you're not that important. You can't say, well, COVID doesn't spread in nurseries or they're not super spreaders when you've got no evidence that they're not, because you don't test children and staff are getting ill. And you certainly can't say that youngsters don't get COVID, because they do. Unfortunately, the younger ones are often asymptomatic. Now, one of the biggest arguments I had at the very beginning was when they opened secondary schools. I would drive past a secondary school and they would say secondary school kids or children should have masks on. Now, I don't know if you've driven past many secondary schools and it's the end of the day and the children all steam out of the playground and they all take their masks off and they're all bunched in a big group. Now, most of these children are bigger than me. And they stand around there, and just before they get on the bus, they put the mask back on. They get off the bus, they take the mask back off. How did anybody in the government think that COVID would not spread? It took them 4 months to decide that actually secondary schools are super spreaders. That's a surprise. I mean, really. You'd speak to most people and they would say, how is that possible? Again, I'm not quite sure how anyone can take the government seriously. I have to keep repeating, this is the same government that told everybody to go back to school for 1 day, which was on the Monday, from a 2-week Christmas break, so that they can all go into settings and spread the virus for everybody to go back home again, and then say no college, no secondary school, no primary school the day after. Yet they've not acknowledged it was a mistake. They've not said why the statistics changed so much, why they did it. They've just started to say how many vaccines they're going to give. I know across the border, Nicola didn't make that mistake. And I know across the border, Nicola Sturgeon said, close primary schools, close nurseries. Now, I'd ask everybody who's listening, what statistics did Nicola receive that she decided to close nurseries that Boris Michael Grove, Gavin Williamson, Vicky, Saul. I know who I'd trust. I know who's made less mistakes over the last 10 months. I know what my money's on. Now, Boris and your cronies, Michael, I'm a great fan of TV. Now, if I had it my way, I'd gather you all together. I'd march you down the street. Now, anyone who watches the Game of Thrones, they will understand this. But I'd say to you guys, shame on you. And as they're walking, I'd expect people to say, shame on you. Shame on you. Now, that's it, really. Again, that is my perspective. Don't believe the hype. Nurseries should be closed. Nurseries should be funded. The government should accept it and do the right thing. Don't make political decisions that affect lives. As I said, I keep saying you have staff members of all ages who are vulnerable. They have families. They need to be looked after. On the one hand, the government says we're the best thing since sliced bread, effectively, how we are the thing that holds society together, get children started. And on the other hand, there's no funding and we're treated like second-class citizens. You can't have the two. And anyone who says otherwise really don't understand it. And on the last point as well, you have to understand is we're not saying close nurseries. We're saying close nurseries to the many, the masses. Leave it open for key workers. What Michael Grove said when he was interviewed was we're opening nurseries, or the nurseries being asked to stay open because it's important to continue childcare for key workers. We're not arguing about that. We're saying that, why are you saying that all nurseries should be open to everybody? It should only be open to key workers. To do anything else would make no sense. Now, if anybody has any other topics you would like me to discuss, I'm happy to do so. Please leave a message and I will see if I can bring that up. But, we have to keep fighting for early years. As I said, it's supposed to keep the country safe. They have this big thing about, wash your hands, save the NHS, save lives. That should be for everybody, not just the government, not just for certain sectors. There's no scientific evidence why nurseries should be open. The government should make that decision sooner than later. Last time I looked, the death rate for today was 1,000. They said in their press conference that there was 1 in 50 people have COVID, but actually in London it's 1 in 30. 1 in 30. So again, 1 in 30. How does the nursery sit outside the 1 in 30? I don't know what else to say. So there you have it, my perspective, and I'll see you guys soon.